Hapon, sir.
May hapon.
Ako day si Nurse Michael Zidar Cruz usa ka student nurse gikan sa Cebu Normal University. Yan, nako karong hapon na parang alagad kanimo. Musta man karon, sir?
Okay ra.
Okay ra. So karon ni sir kay ma-perform ko kanang assessment sa imong abdomen or kinasimantiyan. Nang ako check if nabay ka na mga bunog-bunog or nabay mo sa panit sa imong tiyan. Nya ako sa dyan i-feel kung nabay mga bukol-bukol. Nya ako mag-use ako stethoscope, sir, para paminaw sa imong kanang bowel sounds sa imong tiyan o kanang mga nating sa mga ugat. Nya, okay ra ba nimo, sir?
Okay.
Sige, sir. Nya kani siya, sir, kay ila kada ka, sir, kay ako makuha na data karon kay kutob na nako ug uban pa mo, sir, kanimo. Nya dinhi siya magawa sa uban pang tao sa lain. So, okay na mo, sir?
Okay.
Sige, sir. First, we'll do inspection. The inspection of the abdominal skin. So, we'll note for color, vascularity, lesion, stray, and scarring. So, based upon initial inspection of the abdominal skin, there is no visible vascularity, and the color of the skin is similar to all sides. There is no bluish which can indicate cyanosis, yellowing which can indicate jaundice, and redness which can indicate inflammation. And the patient, there is also no scarring nor lesion on the patient's abdominal skin. Now we'll inspect the umbilicus for its color, location, and its contour. So based upon the inspection of the umbilicus, the patient has an inverted umbilicus and it is found in the medial portion of the abdomen, and its contour is not fully sunken, but it is also protruding. So it's a normal inverted one. Now we'll observe for the contour of the abdomen. Based on the inspection, the abdomen has no sunkenness, no distension, and no ascites, so the contour of it is normal. And looking for the symmetry, we'll compare one side of the abdomen to the other side, and based upon inspection, the abdomen of the patient is symmetrical. And now we'll observe for abdominal movement. So upon the patient's inhalation, the abdomen rises a little bit, and upon exhalation, it sinks down. Aside from that, there is no peristaltic movement observed. Inspection will now proceed to auscultation. In this portion, we'll use the diaphragm of the stethoscope and begin at the right upper quadrant, rotating clockwise towards the right lower quadrant. So in this part, we'll note for the bowel movements, the bowel sounds, noting for the pitch, frequency, and its intensity. So, magbutang ako sa stethoscope, sir, ha? Relax lang. Okay, so on the four quadrants, vowel sounds could be heard, and it is high pitch and its intensity is not that strong. So now I'll listen again and note for how many clicks and gurgles the vowel sounds have made within a minute. Okay, so within a minute, the stomach has made 19 clicks and gurgles. Time, we will now listen for vascular sounds. Again, starting from the right upper quadrant, rotating clockwise towards the right lower quadrant, And we'll also hear for vascular sounds around the periauricular area. This time we'll use the bell of the stethoscope as vascular sounds such as friction rubs and breaths can be heard only using the bell. So, sir, magkuha ka bike ha? Stethoscope ka bike ha? Relax lang, sir. Okay, so upon auscultating, there were no breaths nor friction rubs heard in the abdominal area and also in the periambicular area. After auscultation, we'll now proceed to percussion. So first, we'll percuss the abdominal area to check if it's tympanic. It should be tympanic in all four quadrants except for the areas of the liver which will sound dull. Ikaw na ako sir ha. Kaya ka na, relax lang. Okay, so upon percussing the abdominal area, the four quadrants are all tympanic except for the areas of the liver which is dull when percussed. We will percuss the liver to check for any enlargement. We'll do this by percussing beginning the mid-clavicular line near the navel area, going down to check for its upper border, and afterwards we'll also percuss starting from the navel area, still mid-clavicular line upwards to check for the lower border. So we'll note the changing from tympanic to dullness, as dullness is the sign that we are already in the liver area. So we'll start for the upper border. Balik ka na ako sa percus. Okay, so this is the upper border. So we'll now look for the lower border. Okay, we have found the lower border. Now we're going to measure the area. So from the lower border to the upper border. So that is 6 centimeters. So there is no enlargement as 6 centimeters is a normal measurement for the liver border. So now we're going to palpate for the spleen. In palpating for the spleen is not normally palpable, but if we let the patient breathe in and palpate the spleen, the sound should remain tympanic. If it will turn to dullness, it means that the spleen is going beyond its normal area, meaning it is enlarged. So we'll ask the patient first to relax and we'll palpate for the area of the spleen, and this should be tympanic. Relax ito sir ha. Okay, so the area of the spleen is tympanic, and now we'll ask the patient to take a deep breath in. The sound should remain tympanic, and if there is dullness, this should indicate an enlargement of the spleen. So, sir, ganang ginhawan ta, sir, ha? And hold na to tong breath. Sige, sir, ginawa, sir. Okay. Okay, so the area of the spleen remains tympanic, meaning there is no enlargement of the spleen. Percussion will now proceed to palpation. In this part, we'll do first light palpation, then afterwards we'll do deep palpation on the four quadrants. So sir, ako i-press mo yan. Ino ko sir, naka-feel ka sakit sir ha. Sige, masagod na ko sir ha. So first, we'll start with the right upper quadrant. Feel sakit sir?
Wala.
Dito sir?
Wala.
Dito sir?
Wala.
Dito sir?
Wala.
Wala ra. So now we'll do deep palpation. Dito sir?
Wala.
Dito sir, nasakit sir?
Wala.
Dito?
Wala.
Dito?
Wala.
Okay, so no tenderness was felt and there is also no guarding behavior. So now we proceed to palpating of the umbilicus. So sige po sir ha, nang ina ko sir, nakama-feel sakit sir ha. So first we'll do light palpation. Hindi sakit sir.
Wala.
So now we'll do deep palpation. Sakit sir.
Wala.
So after the umbilicus, we'll also palpate the aorta. In this part, we'll note for any thrills or any like blowing feels in the iliac aorta, and we'll also note for the pulse rate. So i-press ako sir niya, ina ko sir at nakamafeel sakit sir ha. Yung sakit sir?
Wala.
Wala ra? Hindi sir, wala ra. Okay, so the client does not note any tenderness upon palpation of the aorta, and I also did not feel any thrills in it. So now we'll note for the pulse rate of the abdominal aorta. Okay, so within a minute, the abdominal aorta has a pulse rate of 79 beats per minute. So palpate for the liver to note its consistency and its tenderness. So sir, ako sa palpate imong ka sir, ako press imong liver dapit ha. Yung ina ko sir, nakamafeel ng sakit kami sir, or ganang masakit ha. Sige. Inhale ka sir. Okay, exhale.
Sakit gamay.
Okay ba sir, inhale. Exhale. Exhale. Hindi sakit sir.
Gamay.
Okay. So the client states that it's slightly tender, and upon feeling for the border of the liver, it is soft. So its consistency is soft. So we also palpate for the spleen to note its consistency and tenderness. So sir, karon sir, kaya ako sa press sir, kaya dito sa isang kilit sa mong hawak ha. Relax ito sir. So inhale. Exhale sir. Inhale sir. Exhale. Inhale. Exhale. Faster. Inhale. Exhale. Okay, so the spleen is not palpable, which is normal since a palpable spleen can indicate an enlargement. So the patient has a normal spleen. To check for appendicitis, so first we'll do the rebound tenderness, and we'll do this by palpating or placing pressure on the McBurney's point, which is found near or below the umbilicus. And upon releasing the pressure of the palpation, if tenderness is felt by the patient, this can indicate that there is appendicitis. So sir, ako i-palpate yung dili sir ha, nung labas appendicitis nimo, or appendix nimo, dili ubos na sa may pusod. Ngayon ako sir, naka-feel sakit sir ha. Yes sir, ako na mo press ako sir ha. Nakaka-feel sakit, sir?
Wala.
Okay, so no tenderness was felt upon palpation, so it is a negative for rebound tenderness. So now also do the Aljosawas test. We'll do this by asking the patient to straighten both of his legs and lift the right leg. Then upon lifting, we'll also push against the leg, and if tenderness is felt on the right lower quadrant, this can indicate that there is appendicitis. So ato si tatlo ka sir ha. Nya i-lift na to ang right leg, sir. Una. Sige, isa. Bangusog, sir, kayo. Nagsakit yung diri, sir.
Wala.
Wala ra. Sige, tikas, sir. May sakit, sir?
Wala.
Wala ra. Okay, so no tenderness upon checking for the iliopsoas. So the last test we'll do is the obturator sign. So in this test, we'll flex both the hips and the knees and will rotate it medially and laterally. If pain is felt in the right lower quadrant, this can indicate that there is a chance for appendicitis. So, sir, i-relax itong pills, sir, ha, niya, actually, rotate. If nakaka-feel sakit sa imong ubos imong cancer sa tiyan, sir, kay ingnan ako, sir, ha.
Oh.
Sige. Ako ni-lift, sir, ha. May sakit, sir?
Wala.
Kani, sir?
Wala.
Hindi sakit ka, sir. May sakit, sir?
Wala.
Kani?
Wala.
Okay, so it's also a negative for the obturator sign, so the patient has no indication of appendicitis. Lastly, we'll do the fluid wave test, and in this test, we'll ask the patient to place their one hand on the middle of the abdomen to separate both sides, and using our one hand, we'll palpate the one side, and for the other one, we'll feel for a significant amount of impulse. If a significant amount of impulse is felt, this can indicate that the patient has ascites. And after performing on the right side, we also do a palpation on the left side, and we also note for an impulse on the right side. So, sir, ibutang to kamot diri, sir, ha, sa itong ato, sir, nga i-press lang kasi ito, sir. Sige, sir. So now we'll palpate this side first, and we'll feel for an impulse on this side. Okay, so there is no impulse felt on the right side. So we'll do the other side now. Okay, there's also no impulse felt on the left side. So the patient is negative on the fluid wave test, meaning there is no indication for ascites.